First tonight, new restrictions just hours away on transgender health care in Missouri.
I know that more families will leave.
And it has some saying, show me the door out of the show me state. Good evening, I'm Brent Solomon. Mike Bush is on assignment. We'll check in with him shortly. Tomorrow morning, a Missouri law banning minors from receiving gender-affirming care will go into effect. The new law also impacts some adults. Our political editor, Mark Maxwell, joins us now with a renewed push to stop the ban.
Brent, good evening. Missouri is one of at least 22 red states to limit or ban gender-affirming care for minors. Courts have stopped or paused those bans from taking effect in several states, but allowed the ban here. Trans advocates, including parents with trans kids, describe Missouri's ban as one of the most severe and extreme in the nation.
Attorney General Andrew Bailey celebrated a Missouri court ruling Friday that said a new law titled Save Adolescents from Experimentation, or the SAFE Act, can go into effect.
I want Missouri to be the safest state in the nation for children, and that's what that's all about.
But trans teens under 18 aren't the only patients impacted by new changes in the law.
My biggest concern is for trans adults who are needing this medication and who cannot afford it.
Missouri lawmakers also banned doctors from prescribing cross-sex hormones, puberty blockers, or gender reassignment surgery to adult patients who get their health insurance or medical care from the state.
Prisoners who are receiving hormones right now, it would detransition them, and that's very harmful.
Renee Friels went with her teen trans daughter to see their family pediatrician and followed the doctor's guidance on how to start that transition process. She said the state's new ban on trans care will push other families in their position out of Missouri.
Many of our families have already left the state, and it has broken our hearts to watch them leave. We've packed boxes. We've actually participated in U-Haul packing and watching them leave.
Promo Missouri's executive director Katie Erker-Lynch said the fight is far from over, adding it is now up to providers, clinicians, and the attorneys at their clinics and hospitals to decide how much risk they're willing to take on. In the Friday court ruling, Judge Stephen Omer wrote, "The science and medical evidence is conflicting and unclear." That's a claim Promo Missouri Board Secretary Arrow Royston called completely false, writing, "Every major medical association in the U.S. supports gender-affirming health care as the standard of care." In a scathing statement to the governor and attorney general, Erker-Lynch wrote, "You have blood on your hands," and said, "You have manipulated systems, grossly overreached your positions, and put your own insecurities and greed for power in front of life-saving medicine for children and low-income Missourians."
Lawmakers will likely take this issue up again in August of 2027, if not sooner, when the ban is scheduled to expire. Trans advocates at Promo Missouri also plan to organize a push calling for patients across the state to come forward and start telling their stories more loudly starting tomorrow.
Mark Maxwell reporting.